I think it's helpful if we start with briefly understanding what burnout is and what it is not. So we know that burnout is a state of emotional exhaustion. It's brought on by prolonged or repeated stress, and it results in depersonalization, cynicism, and a lack of engagement in work. The research is actually very clear on this. The number one factor is unmanageable workloads in the context of poor work environments. It's not the work itself being difficult, but rather it's the organizational failures that are hindering nurses from doing their work effectively that drive nurses to feel burnt out. In a more recent study, we asked nurses, what would be the most important intervention that your hospital could do to prevent your burnout or reduce your burnout? And the number one thing that the vast majority of nurses said was to improve nurse staffing levels. That rose high above all of the other possible interventions. We also have another study underway that was led by a postdoc, Jane Muir, in the Center for Health Outcomes and Policy Research. And we asked nurses who said they wouldn't recommend their hospital as a place to work to colleagues. So nurses talking to nurses and saying, like, don't come work here. It's a bad place to work. And we asked them why. Why wouldn't you recommend this place? The primary theme there was that this hospital has unmanageable workloads. You're going to have a lot of patients to care for. You're not going to have a lot of support to do it. And we actually just did a study asking nurses who used to work in hospitals but are no longer employed what the major contributing factors were for ending their employment. Planned retirement was the leading reason, which is, a natural loss to the profession that is to be expected. The second most common thing was insufficient staffing was the reason they left their work, as well as poor work-life balance and unsafe working conditions. So they don't want to work in these environments where they feel like their license is constantly on the line because they're forced to do things that are not safe for patients. We also asked nurses, what interventions aren't going to be effective in reducing or preventing your burnout. And they said things that are largely the things we're hearing hospitals are doing. So there's a real mismatch in what hospitals think they should do and what nurses want them to do. So nurses said appointing clinician wellness champions is not effective. Providing resiliency training is not effective. And again, those are interventions that are really targeting the individual as opposed to addressing dysfunctions at the organization level that are putting this undue stress on frontline workers who are being hampered in doing their jobs effectively. So again, if hospitals and other employers of nurses are really serious about addressing the drivers of burnout, they really need to dispense with these ideas of throwing pizza parties and doing resiliency trainings, and instead be responsive to what nurses say they want and need, which is manageable and safe workloads.